What is circumcision? Circumcision is the surgical removal of the thin skin covering the head of the penis, called the foreskin. This procedure is fairly common for male babies in some parts of the world. What is the best time for circumcision? Circumcision can be performed later than birth, but the procedure becomes more complicated. The earlier the circumcision or circumcision is performed, the easier and less painful it is. Circumcision of newborn boys is performed in the hospital nursery within 10 days after birth, and circumcision can be performed several hours after birth. Circumcision may be performed on older children and adults to prevent genital infections and sexually transmitted diseases. In addition, older children or adults may need circumcision to treat a number of conditions, including inflammation and swelling of the foreskin, inflammation of the head of the penis, inability to retract the foreskin. How is circumcision performed? After answering the question of what is male circumcision, we discuss how to perform the circumcision of a newborn male. It is preferable to change the baby's diaper before performing the newborn circumcision, and to bring another clean diaper to use after the procedure. The circumcision procedure for a boy usually takes about 10 minutes, and the procedure for male circumcision for newborns and adults or older children is similar. Circumcision is performed by a gynecologist or obstetrician, but it can also be performed by a pediatric surgeon or general surgeon. Circumcision can be performed in a doctor's office, but it is important that the surgery is performed in a sterile environment. What are the benefits of male circumcision? The reason for male circumcision and the health benefits of circumcision are as follows. Facilitating the maintenance of hygiene, as circumcision facilitates washing and cleaning the penis, and preventing inflammation of the penis. Reducing the risk of urinary tract infections, as exposure to severe infections in early childhood can lead to kidney problems later. Reduce the risk of sexually transmitted diseases, reducing problems associated with the penis. Sometimes, the foreskin is too tight and difficult or impossible to retract. In this case, the need for circumcision of the newborn is medical, as this can lead to inflammation of the foreskin or head of the penis. Reduced risk of penile cancer. Although penile cancer is a rare type of cancer, it is less common in men who undergo circumcision. When should circumcision be delayed? Although early circumcision is best for the child to avoid any serious complications, there are cases that require delaying circumcision, including having blood clotting disorders, premature babies who still need medical care in the hospital nursery, children born with abnormalities of the penis. In these cases, circumcision can lead to some problems and complications. The most common complications associated with male circumcision are bleeding, infection, side effects related to anesthesia. Read also penile fungus in men. What are the risks of male circumcision? The risks of male circumcision are rare, but may be more common in adults and include inflammation and infection, heavy, persistent bleeding, cut off a large part that extends beyond the foreskin, inflammation of the foreskin or glans penis, penile inflammation. Other complications of improper male circumcision or circumcision can include cut the foreskin into short or long pieces, failure of the foreskin to heal properly, reattachment of the remaining foreskin to the end of the penis, which requires minor surgical repair. For more, treatment of penile inflammation and swelling.